Hello and welcome to ReverieTrueCrime. I'm your host, Paige. Today we're going to be diving into a case involving Munchausen syndrome by proxy, now known as Factitious Disorder. First identified in 1951 and named Munchausen after Baron von Munchausen, who was a traveler in the 18th century known for his tall tales, Munchausen by proxy is a psychological disorder, usually in a parent or someone who is a caregiver to someone else. People with this disorder crave attention, and the way they get that attention is oftentimes, like the case we'll be talking about today, by taking a child to healthcare providers constantly. The person exaggerates the symptoms that the child may or may not have, and they make up symptoms out of thin air, pretending that the child is sick or sicker than they might be. Doctors will attempt to find out what's wrong, but usually they can't figure it out, and the caregiver will come up with even more symptoms as they go along. Usually, there's nothing the caregiver wants materially. They just want to be seen as this loving, caring, desperate person who is looking for help for their loved one. They want people to praise them and give them that attention they desire, all by making everyone, even the person in their care, think something is terribly wrong. Sometimes it goes even further than making up symptoms. The caregiver may even go so far as to contaminate a urine sample, falsify medical records, and even induce actual symptoms in the individual by putting something in their food and or drinks such as poison. Some of these people even starve and suffocate the helpless victim in some cases. There are warning signs to look for, but it is absolutely difficult to know for sure who has MSP and who doesn't. Some people do get falsely accused of having MSP or factitious disorder. The majority of people with Munchausen syndrome by proxy are women. They may pretend to be physically and or mentally ill, but often we hear more cases of women using children. Though women are not always the perpetrators, and people might not use their child. The victim can be an elderly person, someone with a disability, or even pets. Sometimes they even have a background or are in healthcare. They come off extremely kind and cooperative, concerned to the point they are overly concerned. They're willing to go through painful tests and procedures to the point they may seem eager to for themselves or the victim they're using for attention. If the person is pretending to be mentally ill, they might mimic behaviors of schizophrenia, which includes acting confused, making off-the-wall statements, and they might report hallucinations. The individual they play caregiver for could be hospitalized multiple times with odd symptoms, and they may become sicker when they're in the hospital or when they are sent home. When the so-called caregiver is not around, the victim usually improves greatly. Other red flags can be if the individual's supposed condition does not match test results. There might be one or more strange illnesses or deaths of those who were under the individual's care before. Also, blood for laboratory samples may not match the blood of the individual under the person's care, and there might be chemicals in the blood, stool, or urine. The person with factitious disorder may have a history of seeking out treatment at many hospitals, clinics, and doctors' offices, possibly even in different cities. There might be a reluctance there when healthcare professionals ask to meet with or talk to family members, friends, and prior healthcare providers. When psychiatric or psychological evaluations are suggested, the person refuses. If they're usually forecasting negative medical outcomes despite there being no evidence, sabotaging discharge plans, or suddenly becoming more ill as they're about to be discharged from the hospital are also red flags. Most people with this condition do not believe they have factitious disorder. They may not be entirely aware of why they are inducing their own illness or someone else's. Many people with factitious disorder may also suffer from other mental disorders, particularly personality or identity disorders. So, how is factitious disorder or Munchausen syndrome by proxy diagnosed? There are so many deceptive behaviors involved that diagnosing factitious disorder is incredibly difficult. Doctors also have to rule out any possible physical and mental illnesses and often use a variety of diagnostic tests and procedures before considering a diagnosis of factitious disorder. If the healthcare provider finds no physical reason for the symptoms, he or she may refer the person to a psychiatrist or psychologist. Psychiatrists and psychologists use thorough history, physical examinations, lab tests, imagery, and psychological testing to evaluate a person for physical and mental conditions. The doctor bases a diagnosis on the exclusion of actual physical or mental illnesses and observation of the patient's attitude and behavior. There are complications of factitious disorder. Hurting themselves or others by causing symptoms is a risk for actual health problems associated with that. In addition, they may suffer health problems related to multiple tests, procedures, and treatments, and are at high risk for substance abuse and suicide attempts. A complication of factitious disorder imposed on another is the abuse and potential death of the victims. This is what we are dealing with today when it comes to the mother of two, Blanca Montano. If you're ready, let's get started. On February 23, 2011, in Tucson, Arizona, 21-year-old Blanca Montano took her 7-month-old daughter and her son, who was a little older, to the University Medical Center. She said they had symptoms of the flu, and while at the hospital, both of the children were diagnosed with an infection. The little boy was soon able to go home, where he improved, and the little girl began to get better at first while in the hospital. Eventually, while she was getting better from E. coli, to the doctor's surprise, she became ill with blood infections that developed from bizarre origins. The doctors became suspicious and concerned that Blanca was doing something to her baby girl to make her even sicker than when she came in. After a month of the baby getting worse with 9 different and rare infections, including fungal, bacterial, and viral infections, she was in critical condition, suffering septic shock. Doctors ran numerous tests, desperately trying to find a cause for the infections, but the causes were never able to be determined by the tests. The baby also went through laparoscopic surgery so the doctors could examine her intestines and stomach, but they were baffled because they couldn't figure out why she was constantly getting worse. They also took some of the baby's bone marrow to perform a biopsy on. The 7-month-old stayed in the intensive care unit with her mother as she dealt with these infections that the doctors were highly worried about because they were either fecal or waterborne. The staff went through all the processes of elimination. Tests for internal issues and pre-existing medical conditions. The medical team looked into the possibility of hospital hygiene lapses or patient-to-patient transfer. It was determined that that was not the case at all due to the types, patterns, and frequency of the infections that were not consistent with typical hospital-acquired infections. Hospital staff realized every time Blanca was alone in the room with her daughter, she would suddenly get worse. The staff even placed hidden cameras in the room to see what was happening when they were not around. Blanca seemed to know that could be a possibility, so she would put blankets around her daughter, hiding her as well as herself being out of view. When Blanca became aware of where the cameras were, she took alcohol wipes and she stuffed them into the holes where the cameras were to prevent them from recording whatever she was doing. The doctors suspected Blanca was giving her little girl something to force her to be sick. They had a patient care conference with Blanca and believed this was a case of Munchausen by proxy. When Blanca was confronted at the conference, everyone said her demeanor stayed generally flat. The medical team described her as having no emotional response at all. She had no reaction to the accusation that she was responsible for her daughter's illnesses. During the meeting, Blanca did admit that she blocked the camera lens. She said she only did that because she was worried about her baby's privacy. Eventually, the police were notified and began to investigate Blanca on March 25, 2011, and Child Protective Services stepped in the same day. Child Protective Services took the baby girl away from Blanca, and she improved greatly after her mother was out of the picture. On April 5, 2011, Blanca Montano was taken to the Pima County Jail and charged with 1 count of child abuse, and her 7-month-old daughter was still in the hospital recovering the next day. A grand jury in Pima County indicted 21-year-old Blanca Montano after they went over the shocking evidence. The evidence showed that Blanca was putting something into the baby's IV to contaminate her. It wasn't released right away what this something was until the trial. While she was in jail, her sister, Yamara, was trying to raise money to get Blanca out of jail. Blanca's father believed his daughter was innocent and that she would never hurt her children. Yamara told ABC News they struggled with this before, and she wanted her sister to have help and not go to jail. She said that their mother, Rosa, was accused of child abuse and her kids were taken away from her. Yamara said that after the investigations into the claims, Rosa was found innocent and she was able to get her children back. Dr. Mark Feldman, a psychiatrist, said this case was typical Munchausen by proxy, and mothers who do this usually have a history of being abused themselves. He said in the handful of cases where mothers have admitted what they were doing, The motive was attention, sympathy, care, and concern. The perpetrating mothers said they felt they were not getting attention they needed in any other way. Dr. Feldman said they felt anonymous in their daily lives and unappreciated as mothers. Therefore, when they get that attention, they don't feel like they are not seen. The attention makes them feel admired and as if they're a wonderful parent for caring for their sick child. There are cases in which mothers have been falsely accused of Munchausen by proxy as well. ABC News reported that in Tennessee, a woman named Julie Patrick founded Mothers Against Munchausen allegations, the acronym being MAMA. She started the group after her infant son, Philip, passed away. In 1996, Vanderbilt University Medical Center officials in Nashville, Tennessee, believed Julie Patrick was a Munchausen mother. Child Protective Services took her infant away from her, and he eventually passed away due to a number of birth defects that included gastrointestinal issues. The accusations that she had Munchausen by proxy were false. Forming the group, Julie told ABC News in 2004, was a way of finding others and to know you're not alone, because you do feel alone when facing such accusations just because doctors cannot find the cause of a chronic illness, or they get exhausted and don't want to deal with the parent or the so-called trouble anymore. Dr. Eric Mart, psychiatrist and author of Munchausen by Proxy Reconsidered, said there's an old saying in medicine: you find what you look for and you look for what you know. Dr. Mart said that there are doctors out there who are quick to call Munchausen by proxy either because they are annoyed by the parents or because they are experts in the disorder and have bias towards identifying it. However, Dr. Feldman says that research shows false allegations are extremely rare, but it does happen. Out of 350 documented cases of Munchausen by proxy, 7 of the mothers were falsely accused. In the majority of the cases of Munchausen by proxy, the children have been treated for years and gone through so many tests because the last resort for doctors was blaming the mother or the caregiver. Some doctors would do anything to avoid going that route, and they don't want to think negatively of their patients' families, especially their mothers, because, Dr. Feldman said, it's counterintuitive that any mother would do this to their child. Sometime after her arrest, Blanca posted $50,000 bail to be released, and on April 20th, after the indictment, her daughter was out of the hospital and still in custody of Child Protective Services. On the 22nd, Blanca was arraigned on the charges of attempted murder and child abuse. On behalf of Blanca, Roger Duncan, the Pima County Superior Court officer, pleaded not guilty. Also, the case was originally signed to Judge John Leonard, but the defense and prosecuting attorneys wanted Judge Jan Kearney to take his place. Why they wanted this change is unclear, and they don't have to give a reason why. Blanca did have a group of supporters, including her uncle Raymond Diaz, who came to the court on April 22nd. Her uncle Raymond stated that his niece was completely innocent, and the charges they gave her were just wrong. A friend of the family, Jean Martin, said that Blanca was a loving, caring young woman who would never hurt her children. Jean was upset at the media for, quote, irresponsible and inflammatory reporting. 2 years later, on May 22, 2013, the attempted murder trial began. The Arizona Daily Star reported that prosecutor Ryan Schmidt told the court they would see evidence that proved Blanca Montano caused her daughter to become very ill with various infections by contaminating her IV in the month the baby was hospitalized. Ryan Schmidt told the court, quote, she was fighting off her own mother infecting her repeatedly. Blanca's attorney, Paul Skitsky, painted her as a devoted mother who never left her little girl's bedside and decorated her hospital room with stuffed animals and balloons. Paul told the court there was nothing they would see that proved Blanca was the cause of her daughter's illnesses. Quote, sometimes things happen. Sometimes there's no explanation for it. The prosecutor said Blanca was caught on video taking the IV tubes and putting them into the baby girl's mouth, as well as coming out of the bathroom with her hand up her sleeve as she was walking to her daughter's bedside, grabbing the IV lines, which caused the alarm on the IV pump to go off. He also mentioned that Blanca covered up the cameras when she discovered them. Blanca's potential motive was also revealed by the prosecutor, saying she caused her daughter to be sick to garner attention from the father of her children in hopes to win him back. Her defense attorney argued that she did not have a shred of evidence against her that would show that she had the equipment or means to do anything to the IV lines in regards to contamination. Along with the attempted first-degree murder charge, she was charged on one count of child abuse, death, or serious injury. The judge who was chosen to oversee the trial was Scott Rash. During the trial, the prosecution told what she contaminated her daughter's IV with. It turned out Blanca was using fecal matter, which caused the baby to be infected with rotavirus, salmonella, serratia, which are all fecal-borne, and Pseudomonas aeruginosa, which is waterborne, and Staphylococcus aureus, which is skin-borne. Medical experts testified that all of which medical experts testified was very unusual or uncommon to find most of these organisms in a blood culture. During the trial, we find out most of what the baby underwent at the hospital, including an echocardiogram, the diagnostic laparoscopy, the bone marrow biopsy, computerized axial tomography scans, magnetic resonance imaging, and immune deficiency tests, among others. The infectious disease doctor who treated the baby testified that he had never seen a patient on the pediatric ICU who had, quote, all these kinds of infections. The prosecuting attorneys talked about all of the specialists who examined the baby, all of the tests that were performed, the surgery, and biopsy when the medical team attempted to find out what was causing the many infections. Every time the little girl started to improve, Blanca would stay in the room with her daughter and she would go downhill again. There was never an explanation or discovery during that hospital stay while she endured all of these procedures and exams as to why she stayed so sick. Blanca said the reason she was messing with the IVs was to untangle them from her baby's feet and get her in a comfortable position. A social worker took the stand and testified that Blanca said she was shocked that the Child Protective Services had not been called sooner. Doctors testified that when Blanca was away from the baby after her arrest, the little girl quickly improved and did not develop any more infections. There was other damning testimony by a nurse who said when the baby was in the care of Child Protective Services, she found syringes in Blanca's purse. She said she was going through things to see what to bring in preparation for the baby to be moved to a different floor. The nurse said she trashed the syringes without thinking much about it. One nurse testified that she had witnessed Blanca once, quote, doing something to the IV lines and had quickly got out of her nursing chair, opened the door, and she quickly sat back down. There was testimony that as Blanca was in her daughter's room 24/7, her behavior was odd and she asked bizarre questions. She was told time and time again not to put the blankets over the baby and to stop shutting the blinds because it interfered when nurses would come in to check on her daughter. Blanca was called detached, emotionless, and it was said that she was not participating in the baby's care, which everyone involved found very weird. Blanca allegedly told one nurse that she had not been excited when she was pregnant with her little girl. Blanca testified that she did not put anything into her daughter's IV and never exposed her to feces. Her defense attorney said the young mother had no reason at all to want to hurt her own baby, and again did not have the means or equipment to do so. Blanca's public defender, Aaron Carrillo, stated that hospital staff jumped to conclusions and pointed their fingers at the mother just to protect themselves and the hospital. Quote, "It's all speculation. There's no evidence to say that she is the cause of the girl's infections. None. The girl could have gotten sick because of lapses in hand hygiene." Aaron talked about 2 separate occasions caught on video of a nurse not wearing gloves. However, when the head nurse testified, she said she could not make out if the nurse was wearing gloves or not, and all of the hospital workers who testified never said anyone ever reported that any of them were not going by the rules of using proper hygiene. Aaron Carrillo also noted that the baby could have been exposed to the bacteria which made her ill because other children in the pediatric intensive care unit had the same bacteria she had. The prosecutor told the jury that the children who had that same bacteria did not have it at the same time Blanca's baby was in the hospital. Quote, "She didn't get it from the hospital, she got it from her mother." He also said it was especially cruel to make her child sick and lie about it to doctors because that made the innocent baby go through so many unnecessary medical procedures. Blanca Montano was found guilty after 3 hours of deliberation by the jury of intentional abuse of a child under the age of 15 with death or serious physical injury likely, a Class 2 felony, on Friday, May 31st, 2013. She was to be sentenced in July. Even after the verdict, Blanca's attorney, Paul Skitsky, told media outlets that she did not harm her baby, and she had borderline intellectual functioning, which should be considered while the sentence is being determined. Quote, "We have to look at it through her abilities. You have to ask yourself, does this young lady really understand the consequences?" At Blanca's sentencing hearing, the judge asked prosecuting attorney Ryan Schmidt if he thought the maximum sentence of 17 years in prison was appropriate. Ryan said he did based on the conduct. Quote, "This is not a one-time thing. I lost my temper and I hurt my child, and I'm very sorry about it. This is it's not only repeated conduct, but it's repeated conduct with absolutely no remorse. The number of infections that the victim suffered, the number of times she came close to death, the tests that were performed on her, the number of doctors that were involved in her treatment, they all had an obviously significant impact on the victim." Blanca's defense attorney told the judge, quote, "Miss Montano, because she's maintained her innocence, continues to maintain her innocence, and she has the right to appeal. I'm asking the court not to hold that acceptance of responsibility or lack of remorse. She can't do that. And that's based on my advice, Judge, so you can't hold that against her." He asked the judge for the minimum sentence of 10 years. Quote, "10 years, Judge, and it's flat time. That's more than sufficient for what's going on when you take into consideration all the factors that circle around here. And Judge, we would ask you to have mercy on her. We would ask you to take her life, her experience, into consideration." The experience Paul was referring to was the dysfunctional family situation he said she grew up in, and he reiterated that she had limited intellectual abilities. The judge did consider mitigating factors, and Blanca Montano was sentenced to 13 years in prison. She and her supporters in the courtroom wept as the sentence was read. Blanca chose not to speak at her sentencing and always maintained her innocence. Blanca, on appeal in 2015, argued that there was not enough evidence that supported her conviction, and the trial court made a mistake in precluding proffered medical records and accused the state of committing prosecutorial misconduct during cross-examination. Her appeal was denied. Blanca Montano has since been released from prison, but I could not find a newspaper or article mentioning her release at all. That concludes today's episode. Thank you so much for listening, and until next time, stay safe and take care.